All right. Well, hey, I want to thank everybody for coming here this morning. I've got the distinguished privilege to introduce Dylan Jolly. He's becoming one of my good buddies. He just does such a fascinating job for us with Med Mutual. Med Mutual being, and I know Dylan, you're going to run through the portfolio products. There's just a couple products that he has that really quite a few of our agents gravitated towards the OEP season when your clients, can't afford the ACA that they're receiving with because of their income, and they're not receiving a subsidy or tax credit. So we're looking at these alternative health plans, and Med Mutual's got an outstanding one. And I've talked to Dylan about this. I was going this route, putting me and my three daughters on the accident and specified disease plan, which Dylan will go through in a minute, until the very end when we would jump on some group insurance. So, without further ado, Dylan, hey, you've got an hour. I don't think you'll take that much, but you are more than welcome to have it. But I just want to introduce Dylan Jolly with Med Mutual. So, Dylan, take it away.
Rob, thank you so much. And I thank Rick Young for allowing me to be here this morning. Thank you for the folks that showed up and want to learn about Med Mutual Protect. I'll try and be concise and brief, and we'll have some Q&A towards the end. But again, my name is Dylan Jolly. I am with Med Mutual Protect. I'm a broker relations manager and carrier rep for us. I have been with the company for going on over 10 years now. Started as an agent and right out of college, so been with them a long time and been a part of the growth initiative and getting our products into hands like you in the hands of you guys and gals. So thank you for being here with me this morning. And we'll dive right in. So Rob, I'm going to send a request to share, if that's okay. A brief backstory on Med Mutual Protect. We have been around since 1956. We started in Oklahoma City just as a private health insurance carrier, and we're selling accident policies to farmers and ranchers. So we have been in the market for a long period of time. We've been in the under 65 space. We do a little bit in the senior space, but just have a long-standing history within the market and serving consumers all across the country. Um, with that being said, over the years, we had some different acquisitions. We were acquired at one point by Kemper, which is a property and casualty company, and they were our parent company for a little bit of time. And then in December of 2022, we were purchased by Medical Mutual of Ohio, and they became our parent company. Medical Mutual of Ohio, longest standing health insurance company in the state of Ohio, long history with being a health insurance company, and they have been a great partner and parent company for us, allowed us to do some different things and really get into the broker distribution market. Really, over the past 24 to 36 months, we have gone full steam ahead in getting our products out in the market and getting them in the hands of agents like yourselves, working with FMOs and really, moving and gravitating towards that broker distribution. Let's see if I'm able to share here. Yep, we're good to go. And I'll clarify on the Med Mutual Protect and Medical Mutual of Ohio relationship. They are our parent company. So some of you on the call are contracted with Med Mutual Protect, but that does not mean that you're contracted with Medical Mutual of Ohio. That's a totally separate entity. They just, provide some backing and are our parent company. So guys and gals, what is Med Mutual Protect? We are a private health insurance carrier that operate and function in the under 65 space, and we do a little bit in the senior space as well, but today's focus is on the under 65 space. Where we fit and what our products help agents and consumers accomplish within the market are really two different things. You can utilize our product portfolio um, as as a supplement to existing coverage. You know, if somebody is on the ACA and they are receiving a pretty good subsidy and they've got a pretty low dollar premium, but maybe they can afford, a little bit more per month. Any one of our products within our portfolio can ride shotgun to that ACA plan to help out with, a high max out of pocket. We all know that the max out of pockets are high on the ACA. It can help out with deductible. It can help out in out of network situations, different things like that. So that is one segment of the market and where our products help folks. Where we see predominantly where we see most of our production and business come from is when agents across the country are utilizing our products to stand alone as somebody's health insurance plan, as an alternative to the ACA, as an alternative to group health insurance when it gets expensive for family members to be on, as an alternative for a small business in comparison to affordability with group health, traditional style group health insurance. We probably have, I'd say 85 to 90% of the business written across the country by brokers is our bundled benefits solution. And I'm going to dive deeper into that now. We have some fairly unique products within the market. Okay. We have and some of this, some guys and gals may have seen this before, but we'll just run back through it. We have a specified disease product that is there's really and truly, to my knowledge and unbiasedly, there's nothing else like it within the market. Okay. There are 20 covered diseases on this product that would trigger coverage for a consumer if they had a diagnosis pertaining to one of these diseases or illnesses. Now, I like to refer to these as more of categories. If you notice here, you've got your big ones: cancer, coronary artery slash cardiovascular disease. I'll touch on that more specifically here in just a second, but that's your heart attack. Stroke is on this product. Diabetes is on this product, end-stage renal failure, and so on and so forth. Now, you notice that the product, this brochure does not explicitly just say heart attack. It says coronary artery slash cardiovascular disease. That's because within the policy specimens, and I can show this towards the end of the call, there are really, I think it's like 8 to 10, maybe more sub-diagnoses that would trigger and fall in that coronary artery cardiovascular disease. Absolutely. That could mean heart attack, but that could also mean, hey, I've got a blood clot in my leg. I've got a brain bleed. Anything having to do with the coronary artery and cardiovascular system would trigger just this product. So it's not just limited to explicitly heart attack. You also notice on this brochure that it says gastrointestinal disease. There are 11 subdiagnoses under that gastrointestinal disease category that would trigger coverage from this product. Okay, so that could be IBS, that could be Crohn's, that could be geosophageal reflux, appendicitis falls under there, and there's many more diagnoses that trigger this product. When we built this product, this specified disease, we wanted it to be broad. We wanted it to be very encompassing and provide that security for the consumer, but also for the agent to know, hey, if I place somebody with this product, I feel really good about a scenario that could happen, and I feel really good about my client being well taken care of because they have this product in place. You also see pneumonia is on there, pancreatitis, gallbladder surgery, disease, Ebola, that's kind of a wild one. Um, but stroke, shingles, psoriasis. So it is very wide ranging in what it covers and what would trigger this product in a claims situation. Now, when we take a look at benefits, well, let me back up. Sometimes at first glance, it is very easy for an agent or somebody to take a look at this and say, oh, that's just a critical illness product. You know, that's your just run-of-the-mill critical illness. I would say that it is probably the furthest thing away from your typical critical illness policy that it could be. And the reason being is we do have a couple of benefit options and selections here that are $0 deductible, 100% coverage, 10 and $25,000 max benefit in a year. That product that benefit design there is there to ride shotgun to a major med or some other type of health insurance plan out there, what have you. Where we really start separating ourselves in the market and truly separating ourselves from that typical run-of-the-mill critical illness policy is we have deductibles, co-insurance, and $1 million per calendar year in benefit on this product. I would say 95% of the applications that are submitted and that include the specified disease are written at the level of the $5,000 deductible, 100% co-insurance, 100% coverage after that deductible, up to $1 million in a calendar year. Okay. So in essence, this product has a max out of pocket on it up to $1 million for the consumer that has this product as part of their health insurance plan. That $1 million is a blanket million. There's not any internal limits where it says, oh, yeah, you got $1 million. We only pay 25,000 for a heart attack, or we only pay 75,000 if you have a stroke. It's a full $1 million to be used however that consumer needs to use it for treatment of whatever illness they may have that falls in line with the product specimens and things like that. This product covers at the emergency room, at the urgent care. It covers on an inpatient basis, covers on an outpatient basis. Very well rounded in how this product can be used. Okay. Um, just a quick example. If Mrs. Jones has to go into the ER and she's having chest pains, and they go in and she hands them the Med Mutual Protect card and they call us and verify benefits and oh, she has a $5,000 deductible. Perfect. We've made a note of that. They're running some diagnostics on Mrs. Jones and they see, hey, you've got blockage here, here, and here in your arteries. We need to do a triple bypass. You're going to be staying with us for a little while. Well, at that time they get her prepped and take her down to surgery, and she's in the hospital for 5 nights. Okay, she has her surgery. She's recovering well, and she's released on day 6. But now, after she's released, she's got follow-up doctor visits with cardiologists. She's maybe got to go see her primary care. Maybe she has a little bit of physical therapy or some type of therapy needed to help with her recovery. Anything revolving around that incident or that diagnosis would be covered at 100% after her $5,000 deductible. Now, let's say that she used $250,000 on her, $250,000 for that heart attack and that 5-night hospital stay. Well, she's still got $750,000 left on the product throughout the rest of the year to be used if she came down with pneumonia or she had to have her gallbladder removed or something like that. So a lot of benefit there. Very easy for you guys as agents to relay to the consumer. Hey, $5,000 deductible covers 100% after that, up to $1 million in a calendar year. It covers these types of diagnoses, and this is the type of protection you would have under this product. Very relatable, and that was by design. We wanted to give that major med feel all while knowing, hey, this isn't a major medical product, but it does have deductible. It does have co-insurance. It does have a lot of benefit, $1 million to cover diagnoses. So, and when a consumer uses that, they do feel like, hey, this works like your traditional major med type insurance. So we'll open it up for questions here in a few minutes on this product, but that is our specified disease. In my opinion, that's the strongest product that we have within our portfolio. It doesn't matter, in my opinion, it doesn't matter what you're selling out there as an agent, whether that's, some other ACA alternative type plans. If you could tack this product on to any kind of health insurance plan out there, you're going to feel really good about your client's protection. We'll move to our accident product now. So pretty straightforward. This product covers accidents, okay? Whether that's cut yourself cooking in the kitchen, you fall off a ladder, car wreck, torn ACL, skiing down the mountain, fishing accident, boating accident, whatever type of accident there might be, it covers accidents. The benefit setup is an exact replica of the specified disease. You've got a couple $0, deductible options that pay 100% up to 10,000 or 25,000. Again, those are designed to maybe ride shotgun to something else, offset some out-of-pocket costs on a major med plan, what have you. But where this accident product really separates itself in the market is we have the deductible, co-insurance, and $1 million in accident coverage per calendar year. Most popular sold on this product when we are designing a health plan to stand alone for that consumer is, again, the 5,000, 100%, 1 million. Functions and operates at the ER, the urgent care, on an inpatient basis, outpatient basis, has physical therapy on it. So if you tear an ACL, skiing, you're gonna have some physical therapy. If you break an ankle, break a leg, break an arm, you might have some physical therapy. After that $5,000 deductible, this product covers that at 100% up to $1 million in a calendar year. So, in speaking about those two products, and what I'm about to show you guys and introduce is, when at MedMutual Protect, when we think about bundling our products into one health plan to stand alone as somebody's health insurance plan, that is the foundation of our bundled benefit solution. Okay. Our specified disease and our accident, that's the catastrophic layer of somebody's health insurance plan when it comes to MedMutual specifically. And the third product that we add into their bundle to really fill some holes and mitigate exposure is our indemnity product. Okay. We call it our bundled benefit solution. Okay. Now, here, I know a lot of you are in Michigan. I couldn't find my Michigan quote, so you'll have to bear with me. I've got a 50-year-old Texas quote here on this quote sheet, but it would be very similar to Michigan rates. Our rates don't differ a whole heck of a lot from state to state. But when we're talking utilizing MedMutual specifically or exclusively, however you want to phrase that, and our product portfolio to build out somebody's health insurance plan to stand alone, the three products that encompass that are our accident, our specified disease, and our hospital indemnity plus product. Okay. So you can see here on this quote sheet, and I personally use this with potential clients, and brokers across the country are utilizing this for their sales calls and quoting and things like that. But you see here, we've got our accident product, lifetime max. There is no lifetime max on our accident product. Benefit period max 1 million, deductible 5,000, benefit percentage 100%. Then we have our specified disease. Lifetime max on the specified disease is 5 million. benefit period max. Benefit period max means calendar year, just so you guys know. Um, it's like your major med deductible. It's like that ACA deductible and benefits there reload every calendar year. You got 1 million per calendar year, $5,000 deductible, 100% coverage after that deductible. Okay. I'm not going to go back through the accident and disease. We just touched on that. But when we add in that hospital indemnity plus, it really accomplishes two things. Okay. It provides benefits, and a lot of you are probably familiar with indemnity out in the market, whether that's from a senior side of things or the under 65 side of things. You know, if you're not, then feel free to ask questions here in a little bit. But I assume most of you are familiar with how indemnity works. So that indemnity product being added to the overall package, the bundled benefits solution, again, does two things. One, it provides benefit for services that might be outside the scope of an accident or a disease. Okay. It also provides benefit to offset that client's exposure on that $5,000 deductible. And how that works is because if I sell this bundle to a consumer out in the market, all of those products within their package work in conjunction with one another. They receive an ID card, hard plastic card, with one ID number, and it's got all their products on that card. And so at time of claim, our TPA is cross-referencing those products, making sure that, okay, hey, this was a heart attack. We've got benefit under the specified disease, obviously, but we've also got hospitalization, surgical benefit under the indemnity that needs to be paid out to. So we do a really good job of being able to cross-reference claims and products within somebody's package just based off of that one ID card that they can use and hand at time of service. You'll see here we have there's six overall plan designs for our Hospital Indemnity Plus. The three most popular are the Essential, Enhanced, and Premier. Lifetime max on the Hospital Indemnity Plus is 5 million, following in sync with our specified disease. Benefit period max, again, calendar year. That's $250,000 in benefit there. Outpatient benefit period max, and I'll touch on this a little deeper here in just a second, but what that is referring to and I like to phrase it as office visit services. Okay, your office visit benefit, your mammogram benefit, your pap smear benefit, your colonoscopy benefit, your labs, your x-rays, EKGs, things like that. We tried to be a little bit unique and carve those benefits out and kind of put them with their own yearly aggregate to be used as many times as that consumer needs to, up to that dollar amount within the year. You can see here hospital confinement under the essential, 1,000 a day, and it goes up in increments there depending on which level that consumer chooses. But we got the hospital confinement, ICU confinement, confinement and rehabilitation facility or skilled nursing, daily confinement and mental health, hospital short stay. So if somebody's at the hospital less than 24 hours, we're going to provide a benefit for that. Hospital admission benefit. That is the benefit that they receive once they are admitted. So the first night in the hospital, that's the benefit they receive. Nights 2 through however many, they receive the regular hospital confinement benefit here. Our surgery benefits are on a tiered system. So we have tier 1 surgery benefits, tier 2 surgery benefits, and tier 3 surgery benefits. Also, you can see here the 25% for assistant surgeon and anesthesia benefit that they receive as well. With our tiered surgery benefit system, historically we've always had all three of these products, just at different type of setups. But our old indemnity was a schedule. Hey, it pays 500 for a broken hand. It pays 1,500 towards ACL repair or biopsy, different things like that. We wanted to make it easier and more simplified from a claims perspective, as well as from an agent perspective, so that you're not having to pull up the chart every time and be like, okay, Mrs. Jones, this part of your package pays X. Surgery, tier one surgical benefits have a set list, and that's going to be more of your, higher end surgeries, heart attack, brain surgery, back surgery, those sorts of things going to fall in that tier one category in that tier one list. Tier three has a set list of services that fall into that bucket. Okay, that's going to be more of your sutures, little stitches, mole removal, smaller scale type surgeries. Anything not on that tier one and tier three list falls to the tier two bucket. Okay, so again, try to make it a little simplified from a claims perspective as well as on our end out in the field. Outpatient benefits. So this is what I was referring to that I like to call office visit services. Maybe they'll let me change that on this brochure, but that's referring to the outpatient benefits, this 5,000, 7,500, or 10,000 in a year is pertaining to this box right here. So under the essential plan, we pay $50 for an office visit. So if Mrs. Jones has a sinus infection, needs to go into her primary care doctor and see what's going on, maybe get a prescription or something like that. For that type of visit, we would pay $50. Okay. The client can go to the doctor as many times as they would like, up to and receive as many of these services within this box as many times as they would like, up to their annual aggregate for outpatient on 5,000, 7,500, or 10,000. So if you've got a client that they like to get quarterly labs, or, I'm sure we've all experienced some of those clients that just like going to the doctor. They can utilize those benefits as they need to up to those yearly aggregates. It's not something where, well, Mrs. Jones, you've only got 10 visits per year or 20 visits per year to be used. We wanted to be different in that aspect with our indemnity product, and we wanted to give that flexibility to the consumer and try to provide a good experience there. I will say this product is changing a little bit come June 1st. Right now, as the product stands, the office visit benefit covers mental health, it covers chiropractic, it covers therapies, things like that. Okay. But come June 1st, those therapy benefits will be carved out into their own category, and the client will have 12 visits for therapy of any kind per year. And that'll be the only visit cap there. We just had to tweak that. This product's been out since August, and after some data, we feel that's a good move for us. So obviously you've got your emergency benefits here, urgent care, indemnity benefits, emergency room indemnity benefits, so on and so forth. Now, what you see here is the monthly premium for this bundled benefit solution. Those prices that you guys see there encompasses our specified disease, our accident, and whatever level of hospital indemnity plus pertains to that column. So for the essential package, if you will, for a 50-year-old in Texas, that monthly premium is $290.37. As you go up, the enhanced package, $375, Premier, $457. And you see the difference in benefits, on this page. Now, all of these products are networked with First Health PPO network, one of the largest throughout the country. Okay. So they can utilize that network. They can hand the card at time of service. But one thing that is unique about us as a carrier is we do not need network participation to pay a claim. Okay. So all we need is that facility to bill us. The client also has when it comes to an indemnity perspective, and sometimes I advise this to clients, they can pay cash, submit that claim for reimbursement, and we as the carrier will pay them their benefits directly. They can really do that in any circumstance, but historically and traditionally, I advise on that for the low dollar type stuff, an office visit, a mammogram, things like that. If that client is open to that concept, they can pay cash at time of service and submit for reimbursement. Typical claim turnaround is running at 14 days, so they should have that check back to them pretty quickly. We also have a mechanism that we could do to have a direct deposit reimbursement if we wanted to. So some unique opportunity there for the client to be strategic on those type of services and so on and so forth. My opinion and my advice is, in an accident situation, in a heart attack or cancer or specified disease situation, hand that card, let that facility bill us directly, and you get the service that you need. So, and I want to clarify that the clients do not have to pay cash. They can if they would like to for their office visits and mammograms and things, or they can hand the card and the facility can file with us. They'll get their network repricing if they're in network, and we'll pay the claim to the provider. So I want to show some real life claims data in an example, and I think it really just shows how powerful one, our specified disease product is, but also this bundled benefit solution, how powerful it is in the market and for consumers across the country. What we're looking at here is a real life appendectomy, emergency appendectomy claim. Okay. You can see all the line items and bills here. I'll get to the bottom. Okay. They initially billed $89,000 and some change, $89,090.79. Through the First Health Network repricing, it repriced that bill by $31,457.96. The client had some testing done prior to this date of service that went towards their deductible. So that's why you see the 4,866 there as patient responsibility and not the 5,000. They've already applied some services towards her deductible. After her responsibility, the remaining portion of her deductible, the specified disease product that you see here, SD3, paid out $52,766.83. Now, this client also the client had the bundled benefits solution. This product type here is our Hospital Indemnity Plus on the premier level. So when it was ran under the Hospital Indemnity Plus, that's one thing that we're working on in claims is where the products could talk to each other. So disregard that patient responsibility because that's already been satisfied by the specified disease, but it was processed under her Hospital Indemnity Plus as well. And the client received a check in indemnity benefits of $10,652.92. Now, I don't sell this package or this bundle as somebody's going to make money on, in a claim scenario or situation, but the way that it's structured, the way those indemnity benefits complement the disease and the accident, and being indemnity benefits, they're a fee of service scheduled benefit they have to pay out. So she was able to recoup some of her deductible and then utilize the remaining as needed for whatever else she might need that for. So I go through that claim situation there to show you guys how the bundle, how those benefits cross-reference and work in conjunction with one another, and how they really provide protection for the consumer. Here's a torn ACL claim from our accident policy. Okay. Again, they had some testing, some physical therapy prior to deciding to go ahead and get the surgery taken care of. So that's why you don't see a full 5,000 there on the deductible. There were some services rendered that were applied to their deductible. But in this situation, the amount billed was $38,489. We had a discount of $96.22. After their deductible, the product paid out 25,740. And it was, it was an in-network situation and all that good stuff. This client also had the bundle, so they received some indemnity benefits as well. Now, the disease and our hospital indemnity plus products are underwritten. I'm sure, if you guys are familiar with MedMutual or contracted already, you've probably seen these questions before, but just pretty standard underwriting questions. We go back 5 years. So if somebody treated for cancer 7 years ago, they would be okay for our products because they're 5 years or more removed from cancer. Same thing on other illnesses. Here's the main gist of the health questions here. Uh, Blood disorders, diabetes or taking medication to control blood sugar, blood disorders, COPD, chronic kidney disease, heart or circulatory, Crohn's, ulcerative colitis, so on and so forth. Pretty standard questions from an underwritten product. Our application is knockout questions on the application. So, if they can't answer no to those, then you cannot proceed, and they would not be approved. Let me stop there. I know I threw a lot at you guys. Would love to, open it up for any kind of Q&A. Rob, if that's okay. Any kind of thoughts, feedback, anything of the sort.
Well, Dylan, hey, you did a fantastic job. And you know what? I always, in my pitch, I preach and teach income and lifestyle protection. So I did get a couple texts, and I know this as you just went through it, and I just want to make sure everybody's aware that this is an indemnity product, that add-on, that bundle product, um, where they actually could make some money because just like you showed, an appendectomy. The young lady got $10,000. Her deductible was five. She's profited $5,000 to maybe help get through those next couple weeks, month, however long the appendectomy is. We all know disability doesn't pay 100% of our income. So, and most of us are living paycheck to paycheck. So having that extra benefit, that extra line of protection, I absolutely love. And I really want to stress on one thing you talked about. It's that $5,000 deductible 100% plan. Dylan, there's five different offerings, and I would not choose anything but the 5,000 100% $1 million a year max and 5 million lifetime. It is just you're just protecting your clients. I mean, we're really looking at putting a bronze plan together minus the preventative. I mean, you've got their hospitalization really rounded out and covered with the accident and specified disease. And then just adding all the bundled product with the hospitalization, the per day benefits on the ICU. The now, if you're going to add the bundle, there is, if you did not see it, for some of that preventative care, $200 a day for 200, 400, 600, I think it was for PAP, mammo, prostate exam. Yeah, if you want to pull that up.
Yeah,
Thanks so much.
right there.
Yeah, it's just it's a rounded out plan for someone who's 50 years old that, can't afford a $750 ACA premium. Now we're looking at 290 or maybe the 375, middle of the row. This is just a great rounded out plan. I absolutely love it. Like I said, it's one of my favorites. We've seen a lot of these alternatives with Rick Young Insurance we're looking at. You've seen some of the different plans that we have. We're really starting to gravitate towards some of the big names, the big carrier names, Med Mutual, and they've been around for quite some time. So they're not going anywhere. Let me just I want to I want to say that. They're here to stay. They've been around. So we're really fortunate to have Dylan and Med Mutual. When we were talking middle of last year, late last year, going through these plans, we just like, this is an outstanding plan, how to package, how to bundle these products. And you're really there not to just protect what the doctor visits. You want to protect what your clients have worked so hard to build. That's where this hospitalization comes in with the accident and the specified disease. And we really rounded out. You got that $5,000 deductible. Hey, you know what I've seen? I've seen some agents throw on a $5,000 critical illness, throw on a $5,000 accident, and they've got a 100% plan, or bundle it like Dylan's showing here. I really love this bundle product. Wherever you want to do the Premier, the Essentials, I think it was. It's just a really nice, more attractive and attainable, affordable plan than going with a full ACA that they can't afford, right? That's what we're doing here. We're looking at those your clients who need to come off the ACA because they're not going to get a subsidy anymore. So I do have another question here, Dylan. Um, Hey, one thing too, I'm glad Amy had asked this because I was going to ask about the claims because I know you had mentioned like, hey, they want for them to talk to each other. Do the claims in the bundle automatically pay out if multiple claims could pay, or will the member have to file each claim type individually? Just
Yeah,
asking.
great question, Amy and Rob. So if the provider, whether the claim is sent in from provider to us directly or consumer files their own claim, the moment that our claims department gets that, they're going to pull up Rob Roney, see his insured ID, and say, okay, he's got our disease, he's got our accident, and he's got our hospital indemnity plus. So, based off of this diagnosis code, we know that the disease product and the hospital indemnity plus were triggered. Or based off of this diagnosis code, we know that that was due to an accident. So we know the accident and the hospital indemnity plus were triggered. Or, the third kind of, what we see is it was Mrs. Jones just went in for a well visit, so the office visit from the hospital indemnity plus, and then maybe she got some labs and a mammogram. That's going to be triggered. In truth, and sometimes it annoys me a little bit, but we issue an EOB for every product that consumer has. Okay. And I don't say it annoys me to scare you guys, but sometimes the consumer might get that accident product EOB and be like, hey, y'all didn't cover anything. Well, Mr. Jones, you got your disease and your hospital indemnity plus EOB that's coming to show that's where it picked up within your bundle. So, Amy, every product within somebody's package, whether they got one product of ours or three or five, they receive an EOB on that. We've cross-referenced each one to make sure all applicable benefits are paid out based off of that one claim submission.
One thing you mentioned also, Dylan, was that I like it's one card. It's not your accident card, your specified disease card, and then your bundle product card. I like that it's all in one. I do.
Yeah, yeah. We try to avoid, the client flipping through their billfold and getting every, whatever card needs, throwing down 50 cards to try and get coverage. That's
Right,
what we want to avoid by doing that. So,
right. All right. Hey, I've got another question for you. Oh, yes, this is being recorded and it will definitely be on the Rick Young website here later today. Does anyone have any other questions for Dylan? Like I said, I absolutely love this product. This was um, me and my three daughters. I was jumping on it this way, and I was just going to offset it with an accident, critical illness, that deductible, and a $5,000, 100% deductible. Who does that scare anymore nowadays? Not many people. What are people used to at ACA if there's two or more? Whether a husband, spouse, single parent, full family, you're looking at $19,000 for the family. 9 grand, 9,200. for an individual. So having a 5,000, 100%, absolutely love it. And the $1 million yearly max, you don't see that often. You're not going to get to it. I remember selling insurance back in the day, and we had a product covered $25 million max. No one's going to hit 25 million, but it was just the sizzle.
Yeah, yeah. One thing I will say, all of our products can be written for child only, so that's kind of unique, a unique niche within the market is, sometimes you come across mom and dad are employed, but man, it's, an arm and a leg to add, little Johnny to their plan. And so, if you need a solution for that scenario, we're here. So that's just something to know.
Yeah, I'm so glad you mentioned that because we've had some cases, right, where you got little Johnny who's 15 or Susie who's 10, and to add them on a couple $100 or maybe up to $500 for a plan to add on a child. I love the child only plan because where are we looking at? We're looking at those 20 diseases, the specified diseases, or if they're active in sports, you're looking at an accident. So having them on that, and I think that premium, I mean, without the bundle, it's like what?
120 to 200
Yeah, for the
through
bundle,
all levels of the essential premier and or essential enhanced and premier. So
and I think it's $70 for the accident and
oh yeah,
specified disease by itself. So
yeah, yeah.
very attainable, attractive, and affordable. I love the bundle because, of course, I think each and every one of you know I love the indemnified products, the indemnity. Trying to protect your client's lifestyle, your client's well-being, your client's finances, and just having them get paid to offset that deductible. Maybe put a little coin in their pocket so they can get through some tough times. Is probably the best way to go. And at a premium that they can afford, that's attainable. It's very attractive. 50-year-old, 290, 375. I think it's very attractive. Oh, get that question really quick.
Yeah, I see that. Yes, so accident has its own 5,000. Specified disease has its own 5,000.
Hmm.
So they would have that throughout the year on both of them.
Yep. Any other questions at all? We've got Dylan here, and he's done such a great job. I'll say something really quick before we get off. You need to get appointed. You need to start looking at MedMutual. I do want to stress no SEPs. You've got, I don't know how many times this year that I've said, hey, my client didn't make their binder payment. Guess what? I mean, there's nothing we can do. You come to March in some trouble. And of course, I'm still getting these conversations that agents are having with their clients. Client called me, doesn't have insurance in April, didn't make their binder payment. And I'm like, here you go, Med Mutual. I mean, this is not just a great way to get them to next open enrollment, but I think, hey, for the next 2, 3 years, on a great policy. Yes, thank you for bringing that up. My
And,
next
and Rob,
statement. Oh, go ahead.
I'll piggyback on that. It just clicked in my brain when you said next 2 to 3 years. Guys and gals, us as health insurance agents, we know how turbulent the market is right now. We know that whoever might come in office next could shake up some things, or whatever DC does. Um, this bundled package, these products are secure, from a rate perspective, from a benefit perspective. They got consumer protections in place across the country with states and being state ran admitted benefits and things like that. So just take that into consideration out there. Um,
Right,
it's a longevity thing, and or could be a good long term.
right. So one last question. If inpatient, do they get the inpatient daily and the ICU benefit? I guess my question, I'll piggyback off that is like, I guess if they're in ICU, I mean, they're inpatient, but they'll probably only get the ICU benefit.
They would get both.
Oh, they're
So
gonna get both. Okay.
if they're in the hospital in ICU, they're getting both benefits, the regular confinement as well as the ICU.
Absolutely love that. Oh, I got one more last question. I was shocked this wasn't asked yet, so thank you for asking it. Commissions. Dylan, where are we starting them at? I know we're starting them over street.
Yep. 25% on year one and 3% renewals.
Love that.
And our
That thing,
commissions are level on every product except our home health care, but on all of our under 65 products, it's that same 25 and 3.
so we wanted at Rick Young Insurance, we wanted to start I think street, they're looking at 20%. We actually wanted to pick you guys up a little bit. So 25%. So thanks for asking the question. Dylan, thanks for saying it. I do have another webinar here in 4 minutes that I got to run. If you want to get appointed, if you're not, I've seen a couple agents that are already appointed on this webinar, but if you are not appointed, reach out to me. I want to send Dylan a bunch of emails today and get you appointed. Start having the conversation. We had an agent just got appointed. I think he's writing 15 of these. He's got construction workers, 35 years old. He's throwing on that specified disease accident rider in the bundle, and I mean it's coming in real like high 100s, and just a great benefit for these 35-year-old construction workers that don't want to pay $400 or $500 on the ACA.
Absolutely. Feel free to reach out anytime. Rob will get me your contact information. We'll get you guys contracted and moving. So
100%.
appreciate the
Dylan,
time today. Yeah.
yeah, hey, thank you so much, man. Really appreciate it, bud.
All right. Y'all have a great day.
Hey,
We'll
you
see you.
too. Bye bye.